Let's get started. Important disclaimer. This experiment is extremely dangerous and should never be attempted. Long-term nail neglect can lead to serious infections, permanent damage, and disability. This is purely educational content designed to help you appreciate the importance of basic nail hygiene. Biological foundation. Your keratin armor. Before we dive into this uncomfortable year-long journey, you need to understand exactly what you'd be neglecting. Your fingernails and toenails are far more sophisticated than simple scratching tools. These structures are composed primarily of alpha-keratin, the same incredibly durable protein found in rhinoceros horns, eagle talons, and horse hooves. This isn't coincidental. Your nails are evolutionary tools designed for protection, precision grip, and fine motor control. The visible nail plate is actually dead tissue, but it's continuously produced by the nail matrix, a specialized factory of rapidly dividing cells hidden beneath your cuticle. This matrix pushes new keratin cells forward at a remarkably consistent rate. Fingernails grow approximately 3.5 m per month, while toenails grow at roughly 1.5 m per month. Over the course of a year, this seemingly slow process compounds dramatically. Your fingernails would extend approximately 42 m, 1.65 inches beyond their normal length, while toenails would grow about 18 m.7 inches. The nail bed beneath your nail plate is rich with blood vessels and nerve endings, which is why nail injuries are so painful. When you regularly trim your nails, you maintain the optimal balance between protection and functionality. But when you abandon this routine, you're not just letting dead tissue grow, you're fundamentally altering the physics of your hands and feet, creating new bacterial ecosystems, and inviting a cascade of physiological problems that evolution never intended modern humans to endure. Within the first few hours of your nail-cutting boycott, your body experiences a curious disconnect between expectation and reality. Physically, nothing has changed. Your nail matrix continues its microscopic cellular production at the same steady pace. However, your brain's somatosensory cortex, the region responsible for processing touch and spatial awareness, begins registering subtle differences in how your fingertips interact with objects. Your nervous system has been conditioned through years of regular nail maintenance to expect smooth, blunted edges. When you encounter the first rough spot or tiny snag, your brain's grooming circuits activate, sending signals to inspect and correct the imperfection. This is a deeply ingrained primate behavior, the same instinct that drives monkeys to meticulously groom each other's fur. By consciously suppressing this urge, you're initiating a minor but persistent stress response. The brain's recognition of this change manifests as increased fingertip awareness. You might find yourself unconsciously running your thumb across your other fingernails, checking for smoothness and symmetry. Your first compensatory mechanism is purely behavioral. Some people begin biting their nails more frequently to compensate for not trimming, while others become hyper-careful about hand movements to avoid snagging. By the end of day 1, your nails have grown perhaps 0.1 mm, barely perceptible, yet enough to begin causing functional changes. The white free edge of your nails becomes slightly more prominent, and you'll notice the first real mechanical issues. Touchscreen accuracy decreases as the nail tips contact the surface before your fingertips can properly register pressure and location. Escalating physical symptoms include increased snagging on fabrics, particularly silk, wool, or synthetic materials. Each snag sends a sharp jolt of tension through the nail plate to the sensitive nail bed, causing microtrauma and localized inflammation. Your body responds with increased blood flow to the affected area, potentially causing slight swelling or throbbing. Psychologically, you may experience mild irritability and obsessive thoughts, especially if you're typically meticulous about grooming. Research shows that interrupting established grooming behaviors can trigger anxiety responses similar to other habit disruptions. The brain's reward circuits, accustomed to the satisfaction of smooth, properly maintained nails, begin sending persistent signals that something needs attention. Sleep disruption becomes common as your slightly longer nails catch on bedsheets or accidentally scratch your skin during REM sleep movements. Your body's stress response activation occurs each time you're jolted awake by an unexpected scratch, releasing small amounts of cortisol and adrenaline that can interfere with sleep quality. If you somehow made it to day 3 without reaching for the clippers, you're entering the zone where minor annoyance transforms into genuine hygiene concerns. By day 5, your fingernails have grown approximately zero point 0.6 beyond their starting point, creating a distinct overhang beyond your fingertips. Congratulations, if you somehow made it to day 5. But here's what your body is going through. The subungual space, the gap between your extended nail and fingertip skin, has become a thriving bacterial ecosystem. This protected environment traps dead skin cells, oils, and moisture, creating perfect conditions for pathogenic bacteria, including Staphylococcus aureus and Enterobacteriaceae, to multiply exponentially. Major symptoms emerge as the extended nails begin experiencing structural stress. The longer they grow, the more leverage force acts upon them during everyday contact with objects. You'll notice increased breakage, splitting, and peeling at the tips as the keratin structure fails under mechanical stress. Medical literature documents that nails extending more than 3 mm beyond the fingertip significantly impair grip strength and fine motor precision. Health risks become apparent as the accumulated debris under your nails creates a potent source of cross-contamination. Studies have found that the area beneath fingernails can harbor up to 5 million bacteria per square centimeter. Every time you touch your face, prepare food, or interact with others, you're potentially transferring these pathogens. Your body's adaptation attempts include unconscious modifications to your grip patterns and typing technique. You begin using the sides of your fingers more frequently, and your brain starts compensating for the reduced tactile sensitivity at your fingertips by relying more heavily on visual feedback for fine motor tasks. At the 1-week mark, your fingernails have extended approximately 0.8 mm beyond their normal length, while toenails have grown about 0.4 mm. This seemingly small change creates profound functional limitations. Entering the danger zone at week 2, chronic condition development accelerates rapidly. The extended nails act as levers, amplifying forces during contact and causing painful pressure on the nail bed. Typing becomes a clumsy, clacking ordeal as you can no longer use the sensitive pads of your fingertips for precise pressure control. Visible changes others would notice include slight discoloration from staining, as everyday interactions with foods, dyes, and environmental contaminants become permanently lodged under the nail plate. The accumulated debris creates a distinctly unclean appearance that signals poor hygiene to observers. Social and lifestyle impacts become significant as simple tasks require conscious adaptation. Buttoning shirts, tying shoelaces, using utensils, and even basic self-care activities like brushing teeth or washing your face become elaborate challenges. Your toenails, now pressing against the inside of your shoes, may cause you to develop an altered gait to minimize pressure, potentially leading to knee, hip, or back pain from biomechanical compensation. The risk of permanent damage begins as constant pressure and trauma can cause the nail matrix to adapt, producing nails that are permanently thicker, more curved, or ridged. Once the nail bed becomes scarred or damaged, even proper future trimming might not restore normal nail appearance or function. Entering months 2-3, your fingernails have grown approximately 710 mm beyond normal length, nearly half an inch of extended nail projecting from your fingertips. At this extreme length, serious health complications become inevitable. The structural integrity of your nails begins failing under their own weight and the constant stress of daily contact. Horizontal ridges called Bowes lines appear, indicating periods of growth disruption caused by trauma. The tips become increasingly brittle and prone to painful breaks that can tear into the quick, causing bleeding and exposing sensitive tissue to infection. Fungal infections become almost guaranteed as the warm, moist environment under the extended nails provides perfect conditions for fungal growth. Your nails may turn yellow, brown, or crumbly, potentially emitting a foul odor. Once established, these infections are notoriously difficult to treat, often requiring months of oral antifungal medication. Irreversible damage potential increases significantly as the constant leverage forces can cause permanent separation of the nail plate from the nail bed. The nail bed may become scarred, leading to nails that never lie flat again even after proper trimming is resumed. Quality of life deterioration becomes severe as basic survival tasks become impossible without assistance. You cannot make a proper fist, hold utensils correctly, or perform personal hygiene tasks safely. The social isolation intensifies as people react with disgust or concern to your appearance. Phase 6. Extreme endpoint, full duration 12 months. At the 1-year milestone, your fingernails have grown approximately 42 mm, 1.65 inci beyond their normal length. This is where the experiment becomes genuinely dangerous and potentially life-threatening. Your nails have likely begun curving dramatically, either downward toward your palm or in various irregular spirals, depending on how they've been stressed and damaged throughout the year. This curvature occurs because nails naturally follow the nail bed contour when short, but once extended far beyond the fingertip, gravity and external forces reshape their trajectory into grotesque configurations. The worst-case scenario analysis reveals complete functional disability. You cannot perform basic activities of daily living without assistance. The weight of the nails creates constant pain and may cause permanent joint damage in your fingers, wrists, and hands. The bacterial and fungal load on your hands poses a serious biohazard risk to yourself and others. Comparison to medical conditions shows similarities to severe onychogryphosis and advanced onychomycosis, both of which can be disabling conditions requiring surgical intervention. The point where the experiment becomes dangerous was actually reached months earlier. At the 1-year mark, you're in medical emergency territory where infections could spread to bone, stadiomyelitis, or bloodstream. Medical intervention necessity is absolute at this stage. You would require professional podiatric or dermatologic care, potentially including partial or complete nail removal under local anesthesia, followed by months of antibiotic or antifungal treatment. When you finally decide to end this nightmare experiment, the process of returning to normal function is complex and potentially painful. You cannot simply use regular nail clippers on nails that have grown to extreme lengths and thickened considerably. What happens when the behavior resumes requires professional medical intervention. A podiatrist or dermatologist would need to use industrial-grade nippers or even rotary tools to carefully remove the excess nail material. The most challenging aspect is that the hyponychium, the skin under the free edge of the nail, may have grown outward to support the extended nail structure, meaning that trimming back to normal length could involve cutting through living, nerve-rich tissue. The healing timeline extends over many months. A complete fingernail takes 4-6 months to fully regenerate from matrix to tip, while toenails require 9-12 months for complete replacement. Any damage to the nail matrix or bed will continue to show in the new nail growth for this entire period. Permanent versus temporary effects depend on the extent of damage sustained. Temporary effects include mild discoloration, slight soreness, and minor ridging that will grow out with new nail. Potentially permanent effects include thickened nails from chronic fungal infection, altered nail shape from matrix scarring, and persistent curvature if structural changes were severe. The lessons learned from this hypothetical experiment underscore that regular nail maintenance isn't just cosmetic, it's essential for maintaining the protective and functional role that evolution designed these structures to serve. Real-world context. Medical professionals regularly encounter the effects of severely neglected nails, typically in elderly patients, individuals with disabilities, or those with mental health conditions that prevent proper self-care. The most extreme documented case is Sridhar Chilal of India, who held the Guinness World Record for longest fingernails on a single hand, growing them for 66 years until 2018. Chilal's experience provides sobering real-world evidence of the consequences. The weight of his nails permanently fused the bones in his wrist and elbow, rendering his hand completely non-functional. He suffered nerve damage that caused hearing loss and required constant assistance with daily activities. His case serves as a stark medical warning about pushing the human body beyond its evolutionary design limits. Research consistently shows that even moderately long nails significantly increase bacterial and fungal colonization compared to short, well-maintained nails. This is why healthcare workers, food service employees, and childcare providers are required to maintain short nails. Pathogens thrive in the protected environment under extended nail plates. Conclusion and safety warning. Over the course of 1 year without cutting your nails, you would progress from minor inconvenience through chronic pain and dysfunction to complete disability and serious health risks. Your nails would transform from protective, functional tools into biological liabilities that interfere with every aspect of daily life. Your body evolved nails at precisely the right growth rate, fast enough to maintain protective coverage, but slow enough that maintenance doesn't become burdensome. The simple act of regular trimming maintains the perfect balance between protection and functionality that millions of years of evolution refined. This experiment is extremely dangerous and should never be attempted. The risks include serious infections, permanent nail deformity and potential disability. Appreciate the remarkable engineering of your nails and the importance of this basic hygiene routine that keeps your hands healthy, functional, and socially acceptable. If you found this educational journey disturbing, you might be interested in our related videos. What happens if you never brush your teeth for 1 year? And what happens if you don't shower for 6 months? Remember, your body is an incredible machine, but it requires regular maintenance to function properly.